Good day, everyone. My name is Liz Powell. I am the founder and head of Women's Health Advocates, as well as G2G Consulting. I am a lobbyist in Washington, and we launched Women's Health Advocates in February 2025. And we have grown and done some great things thanks to all of you since then. Every month, we get together the first Wednesday of the month at noon Eastern Time, where we go over what's happening in the landscape of policy, politics impacting the health of women, and then what are we working to advocate for these days so you can get involved. So today's agenda entails a very special speaker named Lizette Ocampo. She is the executive director of Vote ER. She is amazing, has amazing background. So we're going to start out with her, and then we're going to do some quick legislative updates, political updates, most importantly, with things heating up with the primaries from yesterday, and then ways for you to get involved. So I just want to say a few things about Lizette before I pass the mic. She has an amazing background. She worked in the Obama White House. She helped enact the Affordable Care Act. She's worked on presidential campaigns. She's worked on Capitol Hill even before that. And she was the executive director of Voto Latino. She has really dedicated her life to making our democracy work. So I'm super honored to have Lizette share some insights with all of us today. Lizette.
Thank you so much for having me. It's so great to be connected to you all. I'm very excited to talk to you today about our organization, Vote ER, and I'm going to go ahead and get started and share some slides. So Vote ER is an organization, it's a nonprofit, nonpartisan nonprofit, working to integrate civic engagement into healthcare. So we work in healthcare spaces to register patients to vote and turn them out to vote. We work with over 80,000 healthcare workers across the country who have our tools, our badges that have QR codes on them that they can show their patients to register to vote. And 2,100 institutions across the country. We've reached over 3.5 million people. And actually, just this year, we're estimated to reach over 2 million patients. And I'll explain how we do this work in health spaces in a bit. Why we do this work? First thing is expanding the access to voting, and strengthening democracy, and ensuring representation. But we also do this because better voting access results in healthier communities. We have this research from the Institute for Responsive Government that created a health and democracy index that shows that the more accessible voting is, the better the health outcomes are. And there is a lot of research on this, on connecting civic participation to health. And, Healthy People 2030 shows voting as a social determinant of health. Over 2,000 studies show consistent association between voting and health equity. Studies on countries, many countries show access to voter participation resulting in better health. Essentially, communities with less political voice have less influence in policies, contributes to greater health inequities. We've worked with the American Medical Association and the National Medical Association to declare voting as a social determinant of health. So essentially, we know that by doing this work, not only are we strengthening democracy, helping people have their voices heard, but also it is leading to better health outcomes for the communities that we serve. And so here's the problem. Even though voting results in health, there are 90 million eligible voters that do not vote. And part of that is meeting voters where they already are to help them register to vote. So our prescription for a healthy democracy is doing just that. Going to health spaces where patients are already going to connect with them about civic participation. And what distinguishes us? There's four main things. We use trusted messengers, which I'll get into a little bit more. We have durable infrastructure for systemic change. We reach voters missing from democracy, and we have proven impact. So, you may all know that health professionals are the most trusted messengers in the country. Nurses are number one by far of many professions. We have doctors up there as well. And similar to relational organizing, when you have someone that you trust engaging you in the process, you're more likely to participate in that process. And so, these trusted messengers in the health space are really important. And if we weren't working with these trusted messengers, we would be missing a huge piece of the puzzle in terms of civic engagement in our country. So the communities that we reach tend to be vulnerable communities. 60% of the voters that we help to vote, to register to vote and to vote, are infrequent or first-time voters. And we see that the voters that we turn out, so the vote ER voters that turn out, are more diverse in the general electorate, more female, and younger. So here you see that of the voters we helped to turn out, 69% of them were women. And compared to the general electorate, that has a turnout of 53% of women. And so we see that we reach a population that may not always, with the diverse population, may not always be included in some voting outreach work. And not only do we is the are the folks we work with and the patients we work with more diverse, more female and younger, but the turnout rates of those we work with are higher than the general electorate. So here you see overall, there's a 20-point gap of our voters turning out at 20 points a higher rate than the general electorate. Same, we see with female voters, women voters, 80% turnout with our voters compared to 59% of the general electorate. And so on, you see with diverse communities, young voters, both rural and non-rural voters, as well as first-time voters. And we think that this has to do with the trusted messenger model. Again, when someone who you trust engages you in the in civic participation and in the electoral process, you're more likely to trust that process and you're more likely to turn out to vote. And how do we do this? So we have five main programs. One, as I mentioned, is we work with healthcare professionals to provide to them these badges that you see here. A lot of health professionals already have name badges because they're medical professionals, like at a hospital, and they usually have a name badge. And you can attach this badge to that, or we also provide lanyards. And you can show this QR code to patients, and they can scan it to register to vote. And then they'll then receive voting reminders for getting out the vote as well. And there's many ways to have this conversation with patients. One way is during social intake. Do you wear your seatbelt? How are things at home? And, are you registered to vote? But we have a lot of training on how this conversation can be had with patients from the healthcare professional. We also have our community civic engagement program that focuses on institutions. In this program, we provide grants to community health centers to integrate voting into their systems. So not only do we work with them so that their health professionals have badges, we have posters they put up in their health facilities, but also we work with them to text their patients. So hundreds of thousands of patients, this year, millions of patients will receive a text from their healthcare center asking them or suggesting to them that they can register to vote and providing a link so that they have the opportunity to register to vote. And also, there are institutions who are integrating voter registration and voter prompts into their electronic health records, such as patient portals. So when a patient logs in to check their appointment, they can see a banner that says, part of being healthy is registering to vote. And then we also work with, we have a fellowship program that trains fellows over 8 months to organize in their communities and run campaigns. That's our Civic Health Fellowship. We have 81 fellows this year from 19 states, and they're doing such incredible work in their communities. We have the Healthy Democracy campaign that works with health students, so medical students, nursing students, to engage them in civic participation, and they do voter registration and other actions and compete with each other across the country. So a school will compete with another school and really each other across the country, and they can see which school is winning. So it's a really fun, healthy competition amongst the medical schools, the nursing schools, and we have winners and that sort of thing. And then we have emergency patient voting. This is when a patient is unexpectedly hospitalized, and they were planning to vote on election day, we make sure that they can still vote. We work with the hospital on their policies, with election officials, and ensure that they're able to exercise their right to vote. We've also focused on some more things this year. Um, with all of that is happening with increased healthcare costs and healthcare cuts, we think it's critically important that we include the importance of the power that people have in their voice to have an impact on their healthcare access through voting. And so we are integrating that in everything, including our digital ads. So someone who is searching for Medicaid eligibility may get an ad about having their voice heard and registering to vote. Um, we also have done advocacy like Medicaid defense. We do that when there is opportunity. We have thousands of health professionals who want to do more, so we engage them in that way. We have done Know Your Rights training when it comes to ICE going to health facilities, and we're working on election integrity to ensure that there's opportunities for our health professionals to be poll watchers, for example. And we're building a long-term civic engagement engine, civic health engine. We're integrating civic engagement institutions. We're doing this fully embedded into clinical workflows and systemic change. And we are creating lifelong organizers and leaders and integrating civic engagement into communities for years to come. One thing that we get asked when we have presentations like this is, how do you use your resources? And here's an example of how we use our resources. So for example, $10,000, this is what it can support in our work. We can reach 120,000 healthcare patients through our community health centers with the text messages and the prompts in their electronic health record systems. We can sponsor a $10,000 support can sponsor 10 fellows, and we could reaching 10,000 potential voters with covering a month of ads that we have with our ads program. So similarly, a $1,000 donation reaches the proportion of that to do 12,000 healthcare patients, one fellow, and 1,000 potential voters. And so we are asking you here, whatever you're able to give, we would love and appreciate the support from you to continue to do this work. It's obviously a critical time right now. We're launching Civic Health Month, which is August. We have 8 different webinars on for our health professionals on how to engage, and we're all preparing for National Voter Registration Day, which is September 15th, which will have many activations and obviously all of the voter registration deadlines that are coming up. So it's a very important time in our organization and in the election cycle, and we would appreciate any sort of support that you might be able to provide. Also, if you are a health professional yourself or in the health space, health administrator, you can order a badge, the free badges to help people register to vote. So here's a QR code, and we'll also put the link in the chat, and also the donation link is also in the chat. And that is the end of my presentation. We need you to build a healthier democracy in both meanings of that. And we really appreciate having us here, and I'm happy to ask any questions if there's time.
Wow, amazing. You powered through that. That's just amazing, all that you're doing. And to show that it really produces results, that people register and they vote. That's really powerful. Thank you so much, Lizette. So Lizette is going to be on for our steering committee call, so we can have more interaction back and forth with Lizette then. So steering committee folks, stay tuned. And everyone else, please go to their website. You can get involved. All the links were put into the chat. So we're just going to keep moving along. I'm going to share some updates on the legislative front. So the appropriations process technically is supposed to end the last day of September. So by October 1, the new fiscal year starts. However, as usual, we're way behind on our appropriations bills. We've only had 3 pass the House and 0 introduced in the Senate. And part of that, or a big part of that reason, is because there's no agreement on top line numbers. So the Democrats in the Senate don't want to work on a deal if they don't even know what those top numbers are. There's other things going on like ICE funding, the SAVE Act, big pressure to put that into the bill. So there's lots of things that are making it complicated. So we now have this continuing resolution, which was introduced a lot earlier than normal, but Speaker Johnson is the one that started this movement and passed in the House 220 to 205. In the Senate, it looked like it wasn't going to get much movement until they came up with a deal to include putting off this new OMB rule that we've all been writing in about to oppose it. So it doesn't block the rule, but it delays its implementation until December 11th when the CR expires. That, obviously we want it completely eliminated because it completely removes peer review as the ultimate determinant of science and of these awards, and it would allow political appointees to just suddenly stop funding or not fund at all. So those are our concerns with just maintaining that science-based system. But what this does by delaying it till December 11th, that will be after the elections. And so we will know sort of what's going to happen in both chambers in the next Congress, which then creates more power if the Democrats have wins for them to negotiate eliminating the rule or doing something more permanent than just this delay. So that is why I think they've come up with that agreement. And so the next item is reconciliation. So for reconciliation, it passed the House 216 to 214, so very, very close. And it did have it had Massey, a Republican, join the Democrats along with Warren Davidson, and then Kevin Kiley, who's an independent. So there were a few defectors. Interestingly, with the continuing resolution, there were 6 Democrats who supported it. So it goes to show you just how tight this House is whenever they take a vote. But anyway, with reconciliation, it's a $95 billion package. It would include funding Iran war and some other items like $13 billion for intelligence, $60 billion for defense, $12 billion for the Farm Bill, and then $10 billion to administer this SAVE Act. So obviously very, very controversial to include that. In the Senate, they don't. They are holding, Majority Leader Thune is holding on the reconciliation package, and they don't have the votes to include the SAVE Act. So we have these Republican members, Lisa Murkowski, Tom Tillis, Susan Collins, Mitch McConnell, have repeatedly voted against it. And Mitch McConnell has been out for quite a while. And Tillis is retiring. Collins is in, very tough reelection. So there's just dynamics going on there that seems very unlikely that this would happen this Congress. And then the final item is just ending the war resolution. So they had a resolution in the House that actually passed. And again, some Republicans crossed over. So 214 to 208, but it was a resolution that's non-binding. In the Senate, they actually tried to move forward a joint resolution that would be binding, but it failed 47 to 49. So just interesting dynamics. There are actually 4 Republicans who didn't vote on that. So those are some of the major issues happening. And as far as our work with women's health, so we have our women's health innovation pilot in the FDA bill in the House. So that's great. Again, since we don't have any Senate bills yet, we don't know Senate. We got some other wins around like an increased funding amount for the Office of Research on Women's Health. We got this medical school education on menopause as part of the curriculum. We got that language in there. So we did get some successes. And obviously we're still working to see what we can get in the Senate. With very few days left though, the Senate doesn't come back until mid-September. The House comes back earlier than that, but with only one chamber in, that limits how much can get done. So I think that a lot is going to be put off, except the continuing resolution. They have to get that done. But I think a lot of other things will just get pushed off until after the elections when they know the power structure going into next year. So that's my quick update on where we are legislatively. I also want to share updates on where we are with women's health advocates. So we continue to grow, which is super exciting. So we now have over 5,000 who have signed up to be in our community. And we have over 5,000 letters that have been sent into Congress, which is super exciting. This is where advocacy is really working. And I'm going to talk specifically. We had a recent big win I'm going to talk about in a sec. Our steering committee is pretty strong, over 100 there. We keep doing more and more briefings and Hill events. Our LinkedIn followers keeps growing. Can't wait till we cross over 10,000. Would love all of us to help do that. If you're not following us on LinkedIn, please do so. Please recommend your friends follow. We try to put very helpful information on there. And we're always bipartisan. We're always pointing out things that are happening, events that are happening, legislation that's moving. So really recommend that. And then obviously Instagram also, we want to get that one up there. So those are just some numbers of women's health advocates in our progress. For our letter writing advocacy, I wanted to highlight these are the letters that are in our system now. And so you can just go to our website and click the button, write a letter, and you can choose which one you want to submit for. And I myself have done these submissions. I haven't done all of them, but I've done a lot of them. So, I am doing this too to my one rep and my two senators. So please join. And there's no limit to how many you can send. If you write for all of these issues, that's great. It really shows them that they've got constituents that care about women's health issues. I want to highlight we have a brand new one on endometriosis. Our Endo and Adeno Coalition has been really amazing. One of our most active committees just from day one, thanks to Nicole Nodar and Jamie Silva and some other amazing leaders that have helped make that happen. So we have an endometriosis letter. And then we've got the menopause one. We had a huge response within 24 hours, well over 100. I think it might be 175 letters on the menopause bills, thanks to our online briefing that was on July 23rd. And amazing job to our volunteers who organized that. Allison Lewin and team were amazing. So wanted to do a special shout out to you all and thank you for doing those letters. And then the Early Act is the one that was tied to, it was really short amount of time, but over 200 letters went in and we were able to, people were making calls, like people were really motivated and taking action, and the bill passed. And so that was really exciting to see that success. And we're working to get that passed in the Senate, which I think can happen this year. So just amazing job, everyone. And then you can see some of the other topics from the OMB rule, HPV, menopause. This is the one bill that was introduced in the Senate that is from the last Congress as well. So we're still promoting that one specifically, our appropriations requests and reimbursement parity. That is a big one we're working on. We helped launch the Surgical Parity Project, which is an amazing resource, surgicalparityproject.org, if you want to get more information on that. But we've got a letter up. We're doing letters in for the current rule that's taking comments right now, as well as to Congress. So getting involved on that parity issue, because just as a reminder, on average, women's essentially same procedure performed on a female versus a male is 30% differential. So if it's a male patient, they're getting reimbursed higher. And for some procedures, it's up to 150% differential. So that's an important issue. Last, I want to close out with some political updates. So as we all know, we were watching Michigan yesterday. So they did recently announce that El Said has won the Democratic primary. So he defeated Stevens. So that was a big one we were watching. And we will see what happens he'll be running against former, I did update that slide. It's not showing it here, but he just was announced as the winner. So he's going to take on Mike Rogers, who's a former congressman who's actually a pretty moderate, worked well across the aisle kind of Republican. So that will be a tough race. But as you can see, I've put in on the list on the House side on the right who all the candidates are. There's a couple primaries still out there, like Florida, Wisconsin. I know Massachusetts and some other states still have primaries as late as September. So we'll see. But now that we have most of our candidates, we can now work on what we want to do with our voter education. So for the House and the Senate, we'll keep tracking and sharing updates. And then the next slide. I'm so sorry, it's happened last time. We have an evaluation form where you can submit people that you would like us to consider. We already have 45 in our system. So we will be going through and racking and stacking and sharing information on the candidates and their record on women's health. There's ways to get involved with writing letters as usual, attending our events. We have a Philly event in August.
Hey Liz, why don't I pop in while you catch your
Sure.
breath? Yeah, this is Katie. So just a couple of things that we have coming up, depending on where you are. This August 11th event in Philadelphia is hosted by our WHA Philadelphia chapter. So if you are in the greater Philly area, we would love to see you there. And then our next congressional briefing is coming up on Tuesday, August 18th, on sexual and gynecological health. We had an amazing turnout for our menopause briefing held in July. And so we're really excited to build off of that momentum on this very important topic in August. The next slide.
Yep. And then we
And
have
then
our perimenopause and menopause Capitol Hill Day. I think it's the first ever. There's never been one before, so that's pretty awesome. We have our Breast Cancer Early Detection Coalition Capitol Hill Day. It's our second annual. And we both will include congressional briefings. For the perimenopause menopause day, it's right in the middle of the day, thanks to our partnership with the National Menopause Foundation and Perry. For the breast cancer one, GE Healthcare is leading a morning event, thanks to Betsy Tower. And then other upcoming events, I just wanted to make sure you had the links there. I think my colleague is going to cut and paste those links so that you can register. We've gotten questions about hotels. So it's a twofer. If you can come in September, you can go to both events and help advocate for both menopause and breast cancer legislation. And we have one hotel where we usually stay at the Residence Inn, and then we have a second hotel that's a little bit cheaper. And all the pricing and information is on the registration link when you register for either of those events. Also, we just want to quickly mention My Vote Our Health. The series keeps progressing, and on August 27th, we are focused on reproductive and maternal health. And so we're excited about that. We've got our monthly breast cancer early detection call on August 12th at noon. So please dial in for that. And then lastly, we always like to close out with ways to be a leader. You can get involved in one of these committees, whether it's a health condition committee or a regional committee. We've got upcoming committee calls. Those are all in the newsletter. And then we try once a week to cut and paste into the WhatsApp. Finally, joining our steering committee. Always there's tidbits that we share on steering that we don't share for the rest of the community. And the steering also shapes our strategic direction. And steering is where we select our speakers. Steering is really vital to keeping this organization going. So special thank you to our steering. And also we invite others to join. For example, I got some new tidbits on why they are testing testosterone in the military now. I learned where that came from. So I'm going to share that in our steering call today. I got some other interesting tidbits about a pending menopause executive order I'm going to share in our steering call as well. So invite folks to join our steering to be part of that inner circle. It's a really valuable, amazing powerhouse group. And lastly, I just want to thank our sponsors. We wouldn't be able to do anything without our amazing sponsors. All these companies, individuals have really dedicated so much to ensuring we can do all these events. And then lastly, just remember, our vote is our voice. So please make sure you register, you get your friends to register, and you get out and vote. Thank you so much, and we'll see steering on the steering call. Bye.